Yes, recurrent sexually transmitted disease or infection can lead to pelvic inflammatory disease. And pelvic inflammatory disease might lead to infertility. I have been saying this on my previous video, and that prompted my audience to make this request. Nurse Mercy Mary, could you please make a full video on pelvic inflammatory disease? Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today we are going to be talking about pelvic inflammatory disease. I believe from the title of the video, you already know what I am going to be talking about. I'm going to be telling you all you need to know about pelvic inflammatory disease, right from the definition, the signs and symptoms, the causes, so you know them and avoid them. But before we go into details into this class, if you are new on our YouTube channel, if this is your first time on our YouTube channel and this is the content you are interested in, please click on the subscribe button, turn on the notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today we're going to be talking about pelvic inflammatory disease. But before I go, you have to calm down. You know our YouTube channel is for both the male and the female. But this disease condition in particular is affecting the female and not the male. So what then is pelvic inflammatory disease? Pelvic inflammatory disease is simply an infection of the upper female reproductive organ. An infection of the upper female reproductive organ. Looking at the structure of the female reproductive organ, you know we have the upper and we have the lower. The lower is where you see your vulva, where you see your vagina, is where you see your clitoris. But the upper is where you see your uterus, the fallopian tube, and also the ovaries. So an infection of the uterus, an infection of the fallopian tube, an infection of the ovary is what we talk about, is what happened when we talk about pelvic inflammatory disease. When one or more of these organs are affected, we say that an individual has what? Pelvic inflammatory disease. There's something you should know about PID. Most women, they don't show sign of PID. They usually have mild or like very mild symptoms, while some may have severe, but majorly most women have mild symptoms. They don't really know that, oh, something is going wrong in the body. They don't even know that they have PID, except when they are trying to conceive or they now start developing chronic pain. That's when, oh, something is wrong, let me just check, let me find out, let me visit the doctor. And after visiting the doctor, they find out that they have pelvic inflammatory disease. You may want to ask, okay, what are the signs and symptoms generally? Though some women experience mild. One of the signs and symptoms are pain. Yes, this particular woman might be having pelvic pain, abdominal pain at that particular moment. Like I earlier said, it might be very mild that you might not even notice, like you might not even take it into consideration. The second signs and symptoms, or I want to share with you, is unusual discharge, unusual or heavy discharge with odor. When an individual is having this unusual discharge, the discharges are not heavy and there are odor attached to this discharge, we might say, oh, something might be wrong. Can you go for a test? Can you check? Let's know what is happening. Then the third one I have to share with you is unusual bleeding from the vagina. So if as a lady you are experiencing unusual bleeding from the vagina, I usually advise you, don't just assume everything is okay, it is normal. It is better for you to see your GP, it is better for you to see your obstetrics and your gynecologist for proper examination. Another signs and symptoms that are likely going to come up might be fever. Yes, infection generally brings fever. This person might also have fever. Person might also be having painful, frequent urination. This person wants to go and pee. The person is feeling pain. The girl is feeling pain. So that might be a sign that, oh, you have to visit the doctor and find out if something is wrong down there. Then that takes us to the causes, because I know you really want to know what is causing pelvic inflammatory disease, so I avoid it. Most of the cause of pelvic inflammatory disease is usually bacteria. bacteria traveling up from the vagina, traveling up. These bacteria, the common ones are usually gonorrhea and chlamydia. They're the ones that usually result in pelvic inflammatory disease. There are other things that can result in pelvic inflammatory disease, such as things that are likely going to obstruct the barrier around the cervix, such as abortion, miscarriage, even menstruation might cause pelvic inflammatory disease. And really, you can get some insertion of IUD, that family planning method, might result in pelvic inflammatory disease. But the last ones I just measured, those ones are rare. But the most common ones that result in pelvic inflammatory disease is actually infection, bacterial infection traveling up to the uterus, to the fallopian tube, and also to the ovaries, such as gonorrhea and chlamydia. You may want to ask, Oscar, what are the risk factors? What are the chances that I am going to get it? The first chance of getting PID, which is pelvic inflammatory disease, the first one I have to share with you is being sexually active and under the age of 25. That increase your chances. Having multiple sex partner might increase your chances. The third one I have to share with you is having a partner that has multiple sex partner. For example, I am not having a multiple sex partner. I just have one part sex partner. But my partner is having multiple sex partner. That increases my chances of what? Of pelvic inflammatory disease. And also, if you have had history, you've had it before, PID before, there's an increased chances of you also getting PID. If you are having frequent STI, frequent sexually transmitted infection, you are at risk of getting what? Pelvic inflammatory disease. Then also douching. I've also made a full video about douching and reasons why you should not douch. When you douch, you might likely get pelvic inflammatory disease. Then having unprotected sex. I am not saying you should use condoms when you are with your partner, that you are legally married or things like that, but having unprotected sex with people out there without knowing their states, to know, okay, if there's sexually transmitted infection free or not, might increase your chances of getting pelvic inflammatory disease. There are different complications associated with pelvic inflammatory disease. The first one is ectopic pregnancy. Yes, ectopic pregnancy is a type of pregnancy in which the baby develops outside the womb. I've made a video of ectopic pregnancy. If you don't really know what ectopic pregnancy is and you want to know, you can watch the video on ectopic pregnancy. That is one of the complications of pelvic inflammatory disease. Then the second complication is infertility. This pelvic inflammatory disease can lead to scar formation. That scar might obstruct the zygote, the baby that is forming, from moving to its from moving to the uterus, might stop it, and that can lead to ectopic pregnancy generally. So infertility is one of the complications of pelvic inflammatory disease. Then we have chronic pain. Chronic pain around the pelvic region might be a complication of pelvic inflammatory disease. Yes, like pain that lasts for 6 months, even a year, the pain is still there. That might be a complication. Then tube ovarian abscess might also be a complication of pelvic inflammatory disease. So this is what I have to share with you in regards to pelvic inflammatory disease. I want you to know that most women, they don't know that they have PID because the symptoms are very, very mild. But when they are trying to have children, that's when they start doing some checkup. They start checking, oh, what is wrong? And also when they have chronic pain, they're like, oh, this pain has been there. I've been taking paracetamol, I've been taking some pain relief, but it's not going. Let me go to the doctor and find out why it is there. During the process of finding out why they are not having children and also why the pain is there, they discover that they have what? Pelvic inflammatory disease. So this is what I have to share with you today in regards to PID. And I hope I've answered the question for those that have been asking. Thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mary saying thank you. Bye, and see you in our next video.